talk to you about how to induce labor naturally. Did you know that only 5% of babies are actually born on their estimated due date? This is a big reason why we encourage all moms in our office to not get hung up on this due date. It's just a calculation and it's an average, but there's actually a big window of time that's really a safe time to be having your baby. You want to make sure to avoid a medical induction unless there's an absolute medical necessity. In that case, your OB or midwife is going to talk to you about why you would want to do that. Now, even if you're considering trying out some of these natural induction techniques, we still recommend that you talk to your birth provider before trying any of them. The first natural induction technique is to have a lot of sex. Semen contains prostaglandins. These have a very similar effect to other cervical ripening medications like Cervidil. My next tip is to try nipple stimulation. However, the best technique is actually to do whole breast stimulation, not just the nipple itself. You can also try using evening primrose oil. This also has prostaglandins just like semen does. However, many birth providers actually warn against evening primrose oil because there can be some severe contraindications to taking it. So they consider this the last possible resort. The next tip is to consume castor oil. The reason this tends to be effective is because it causes your intestines to contract, which will ultimately make the uterus contract. Unfortunately, these intestinal contractions can cause diarrhea, which can make you incredibly uncomfortable or dehydrated, so you want to be very careful taking this. Drinking red raspberry leaf tea throughout your pregnancy is really great to help strengthen the uterus and pelvic wall. In order to help kickstart labor, you'll want to increase your tea to a double brew dose. As a prenatal chiropractor, there are several things that I recommend my moms do as they approach their estimated due date. There's a neurological reason that I recommend all moms do things that help relax them as they approach their due date. In your nervous system, you have two different modes of function. You have the stress response, which you've probably heard referred to as your fight or flight. This is really important for times like when you're running away from a bear. And then the other side of things is your relaxed response. So this is where things like rest, digestion, immune response, that all happens. Another thing that happens there is the production of the hormone oxytocin, which is really important for starting labor. So of course, the number one thing I'm going to recommend to all my moms is that they're getting adjusted throughout their pregnancy, and especially probably a few extra adjustments as they get closer to their due date. Moms should also be making the time to do things like relaxing, self-care, maybe go get pampered, meditation, focus on birth affirmations. All these types of things are going to be really, really great for helping her shift into that relaxed state of function so that she can go into labor naturally. Remember, it's okay if you go past 40 weeks. Your due date is just an estimation, so don't get hung up on that date and allow your body to do what it needs to do. If you want to start talking about some of these induction techniques, make sure you speak to your birth provider before trying any of them. Thanks so much for joining us for today's Buns in the Ovens. I hope that some of these techniques help you if you need to use them.